This presentation is on a performance audit by the Queensland Audit Office on the management of privately operated prisons. This report was tabled in Parliament on the 16th of February 2016. QAO delivers financial and performance audit services to give assurance to Parliament and the community about the performance and accountability of the public sector. Performance audits assess whether an entity is achieving its objectives economically, efficiently and effectively, and is complying with relevant laws. Private prison is a prison that a third party operates on behalf of Queensland Corrective Services. Privately run prisons have been operating in Queensland since 1990, when the Burrallan Correctional Centre near Ipswich became Australia's first. There are now 2 private prisons in Queensland, the Arthur Gorrie Correctional Centre at Wacol and the Southern Queensland Correctional Centre at Gatton. It is the government's policy to operate only 2 prisons privately. Queensland currently holds 19% of its prisoners in private prisons, with the rest in public prisons. When government decides to outsource prison operations, it expects that this will deliver cost savings whilst maintaining an acceptable level of prison services. The objective of our audit was to examine whether the intended benefits to the state of privately operated prisons are being realised. The entities included in our audit were Queensland Corrective Services, which is a business area of the Department of Justice and Attorney General, and Queensland Health. Queensland Corrective Services is responsible for managing the state's contract with the private operators. This includes setting performance expectations and assessing and managing the private operators' performance. Queensland Health assumed responsibility for prisoner health services from Queensland Corrective Services on the 1st of July 2008. Queensland Health provides medical services in all public prisons and mental health and dental services in private and public prisons. We concluded that the private provision of prison services in the state's prison system is realising significant cost savings while providing a level of service commensurate with publicly run prisons. The opportunity exists to obtain a greater understanding of how private prison providers operate, particularly in understanding how they achieve cost efficiency, so better practices can be established in public prisons. The state can also achieve greater value from its contracts with private operators by giving them more incentive to innovate. We also identified that Queensland Health delivers its medical services in public prisons at a significantly higher cost than private operators. We estimate that Queensland Corrective Services has delivered cost savings of about $55 million, or 19%, from its privately operated prisons from 2008 to 2012 for the Arthur Gorrie Correctional Centre, and from 2012 to 2014 for the Southern Queensland Correctional Centre. Private operators can deliver prison operations at a lower cost than the public sector because their costs for labour, medical and overheads are lower. The cost of medical services is one of the greatest cost differentials between the public and private modes of prison operations. We identified about a 45 to 60% lower cost for the private sector to deliver prison medical services for the Southern Queensland Correctional Centre and the Burrallan Correctional Centre, which will be recommissioned in 2016 as a publicly run prison. We recommended that the Department of Justice and Attorney General and Queensland Health complete a cost-benefit analysis of options for delivering medical services more cost-effectively in prisons. We identified that on a marginal cost basis, Queensland's 8 public high-security prisons are at least 65% more expensive to operate than its 2 private prisons. The marginal cost is how much extra is required to be spent on each additional prisoner. We compared performance data of public and private prisons and found that the private operators' performance is comparable to public operators in almost all areas we examined. The rate of illicit drug use is a key area of concern for both private and public prisons. Queensland Corrective Services monitors the performance of its private operators at a more detailed level than what it does for its public prisons. This is especially in relation to the quality of food services and measuring the time prisoners spend in meaningful activity such as training and employment. We recommended that the Department of Justice and Attorney General compares and contrasts the operating standards of public and private prisons, and where gaps exist, implement better practice operating standards in all public prisons. Queensland Health is not satisfying the demand for emergency dental care in public and private prisons, and this is placing the health of prisoners at risk. The private operators are not able to influence this because it is not their area of responsibility. Because it did not competitively tender the Southern Queensland Correctional Centre contract, Queensland Corrective Services is unable to demonstrate that they are not paying more than they need to for the Southern Queensland Correctional Centre. Queensland Corrective Services has not clearly defined the contract objectives in its private prison contracts. It has not maximised the value it achieves from private prison contracts because it designed its performance management framework to measure operational performance and not for assessing how well operators deliver prisoner-related outcomes. We recommended that the Department of Justice and Attorney General develops an outcome-focused performance management system for private prison contracts. Overall, we made 7 recommendations which the Department of Justice and Attorney General and Queensland Health accepted. The report can be found on our website. Any questions, please contact the Queensland Audit Office.